We're calling it Living Well, but let's call this an opportunity to possibly save someone's life. And Lou and I are very proud of the work we get to do with the American Heart Association. We were there with the Heart Walk not too long ago. And during that opportunity, an amazing event, some various individuals came up to us and told us their individual story. And when this young lady came up to me, it warmed my heart and brought tears to my eyes. So we wanted to share that story with you this morning here on Iowa Live. So we want to say a very good morning to this beautiful young lady, Hannah Brown. Thank you so much for being here today. Now, we're specifically here talking about American Stroke Month. I know May's almost done, but it still is American Stroke Month, and it's still an opportunity to talk about the signs of what it means to have a stroke. But why are we talking to you this morning when it comes to stroke?
Because I mean, I had one back in December.
You had a stroke in December.
And if you don't mind, share how old you are.
I'm 21.
You are
21 years old.
Yes.
But that's not the complete story. Let's back this up a little bit as we're talking with the relationship with American Heart Association. You also had another condition that happened before your stroke.
Yes, so on December 3rd, I had a heart attack, but I didn't know that I did. I was told I was having heartburn, so I went a week untreated.
Okay, let's take a one step back here again. Let's go through some of the things that you were going through when you knew something was wrong. About what time did this happen?
A lot, like alluding to the heart attack?
Yeah, alluding to the heart attack, yeah, before we get to the stroke. So this is because this is leading up to what happened with your stroke, but what happened? What unfolded?
So I woke up at 3 a.m. It was actually the Saturday, because Monday was the 3rd. I woke up on Saturday with a burning chest pain, and I just was like, maybe it was something I ate. I had went out for Italian the night before, so I was like, oh, I could have gotten heartburn from that. But the pain kind of stuck with me all day, and I just kind of blew through it. And then I woke up on December 3rd, a Monday, and my chest really hurt. It kind of felt like I had gotten kicked in the chest. And I remember just messaging my boss saying, hey, I'm not going to come in today, and took myself to a walk-in clinic. And they told me that with my chest pains and the way I was feeling, that it just sounds like heartburn for my age.
Even that many days later, they were still saying just heartburn.
Yes.
Okay.
Wow. But I want people to recognize this, because we all deal with heartburn and things as we get older or even younger. There was something that wasn't right, and to me that was, it got progressively worse and lasted for a few days.
And it was like different than heartburn. Heartburn, you can feel it right here.
Right.
This was like a radiating, like all the way out to here, chest pain. Like it just felt, it was kind of excruciating for that kind of pain.
So you mentioned when you were describing that, they said with your age, so that your age did come into play on what they were trying to figure out what was wrong with you, correct? Okay.
But you went to the experts. Experts said you were just having some heartburn. So what happened after that?
They prescribed me a heartburn medicine, and I went home. Then went to work the next day, like nothing was going on, and just kind of chugged along.
No, so did this pain persist for the remainder of that week, or did it kind of subside a little bit?
I think it did subside.
Okay.
So I was like, well,
maybe
I'm not going to take that heartburn medicine then if I don't need it.
I'm not going back to that Italian restaurant.
I'll save it for later. Okay, now let's get to, let's move along a couple of more days. And he said it was about a week later?
It was exactly a week later.
Exactly a week later. Then what happened?
On December 11th, after work, we had a couple friends over. It was me, my boyfriend, and 2 friends. And we were just having some drinks, hanging out, watching movies. And I remember sitting there, I had opened my beverage, and then all of a sudden I started to get numbness and tingling right here. And I was like, guys, my fingers are really numb. And I knew my blood sugar wasn't low, but because I have type 1 diabetes, so that's immediately where my head goes. If anything starts to feel weird.
You're aware.
And then it just started to creep up my arm, and then I'm sitting there on the floor trying to look for a movie, and I'm trying to say the movie titles, and it's not making any sense. And at first it was funny, because we're like, what's going on? What could this be? Like, why am I talking funny? And then it started to not be funny when it wouldn't go away. And when my right leg started giving out, I remember basically limping to my little sister's room and going in there and crying, and just not knowing what was going on, I guess, was really scary, and laying in her bed and just crying, and I kept trying to say allergic, and it kept coming out allergic, which it was like really scary. I couldn't
Now,
communicate what was
Right.
going
was
on.
stroke bouncing around the back of your head? Maybe this is what's going on. Did that come to mind?
Like for a fleeting moment.
Yeah.
And I remember my sister looks at me and she's like, you're too young to have a stroke. She's like, you're not having a stroke. And so I just, I was frustrated. I didn't know what to do. So I went back into the living room and our friends left, and he didn't know what was going on either. And he asked to take me to the hospital and I said no. Because I thought stroke, but I didn't actually think that's what was really going on. I didn't know.
As a 21-year-old, who would ever think what I'm feeling right now is I'm having a stroke? But that's exactly what happened. So obviously you were able to get the treatment that you needed. How severe was this stroke? Talk a little bit about your rehab that you had to go through.
Well, so again, like I said, I went to bed that night. So I'm really lucky that I woke up the next morning and I drove myself to work. And then I went to the hospital and they said I had an ischemic stroke, or ischemic. I might have said that wrong. So I'm sorry. So basically it was on the left side of my brain. That's why it affected my right side.
Because I always heard left side. Your left side was affected, but so this was affecting your right side of your body.
Yep.
Okay.
So if you have a blood clot on the left side of your brain, it's going to affect your right side. If it's on the right side, it's going to affect your left side. So opposites.
Okay.
Unbelievable. And we're showing
Wow.
images of you being in the hospital, your brain there, just to kind of show you what exactly happened. It's an incredible story, and that's why we wanted to talk about it this morning, not only your age, but the fact that you had a heart attack and a stroke at 21. But you are here with us, and we're able to talk about some prevention. So no matter what your age is, if you see some certain signs, you need to act fast. And we say fast for a specific reason. I know we have some graphics we can pull up to show exactly what this means. Again, as we're celebrating or supporting or whatever you want to call it, American Stroke Month, we want to make sure you keep in mind, if you see face drooping, if you feel that numbness or part of your body isn't working, you get attention immediately. Arm weakness, you brought that up. Speech difficulty, another sign.
Talked about that,
and time. So that's your fast. Face drooping, arm weakness, speech difficulty, time to call 911. Don't wait. You need to act fast, literally, so that you can save someone's life.
Now, how are you doing right now?
Good. I had a stent put in my heart for the blood clot, so it wouldn't happen again, the stroke. And then I was just cleared for everything
Look at that photo.
in March.
There you go. Who's the little doggy?
My boyfriend and sister snuck my dog in.
Good job out of you.
Support there. But can we also recognize that through everything you've been through, not only are you an incredible advocate and are sharing your story with as many people as possible, but you also volunteer time with the American Heart Association. Why is that important for you to not only get the message out, but then also to give back in this way?
Well, since I do have a couple different conditions, I think it's really important because you hear a lot of people talk about stigmas and stereotypes for having, oh, you had a heart attack at a young age because of this, or because you were doing this wrong, or you have diabetes, for example, because you ate too much sugar or something. I like to break that stereotype and be an advocate, because if people don't know, they're not going to know. They're not going to understand it. They're not going to try to help us work towards, making it better, or, recognizing the signs if they don't understand it.
Absolutely. Well, thank you again for sharing your story with us this
glad you're
morning.
here.
The faster stroke is treated, the more likely the patient is to recover. So again, remember, fast. If you see face drooping, if you notice arm weakness, if there is any speech difficulty, the time to act is now, and that means don't be afraid to call 911. If we work together, we can hopefully end stroke or possibly save someone's life. Hannah, you're amazing. Thank you so much
Thank
for
you so
joining
much
us
for
this
being
morning
here.
and sharing your story.